Hello, I'm Yvonne, coming to you from JK Lifestyles with Yvonne. Today, we're being joined by Sara Aharon. She's a health psychologist. She developed a highly effective treatment program for Canadian soldiers and first responders that are dealing with addiction and trauma. And she's interviewed talking about her work on television, radio, and written media. Hi, how are you today?
Good, thank you. How are you?
I'm well. I'm well. And we also have Koya Bakare. She is a survivor. She's going through so many challenging things and she's come out on the other side. So I'm so happy you're here today.
Thank you.
I have Teresa LaRue. She's a domestic violence survivor. She's the author of a book, My Rock, My Hard Place. And she's the creator of workshops for other survivors. One of them is called Survive, Rise to Thrive. How is everybody doing?
Great. Doing well. Feels good to be amongst you beautiful souls. It was amazing.
It's good. I feel happy being here with y'all too. Okay, one of the things that you talk about, Sara, you talk about trauma and you talk about addiction. Explain to us what trauma is.
So, if I go by Bessel van der Kolk's definition, he's one of the experts that I trained with. He describes trauma as an, an excessive an especially stressful event that exceeds the person's capacity to cope. So there is a connection between an event and the person's resources, and resources can be social, psychological, genetic, and so on. And because of that, not all events that, let's say, you and I would consider traumatic would be experienced as traumatic to someone else. So
Mhm.
there are some events that we could say are agreed upon as objectively traumatic. But even then, I have seen people who respond very differently to similar events. So we have to put it in the context of each person's capacity to cope with a given highly stressful event.
What are some of the effects of a lot of stress on a person? How would they choose to cope? What are some of the ways that they would choose to cope?
Yeah, so if we look at the effects, we can look at, how the nervous system of the person responds. So if there is a high level of activation, heart racing, high blood pressure, a lot of adrenaline is released, and so on. Um, Again, depending on the resources of the person, some may go to, some kind of substances, alcohol, drugs to self-medicate, to numb, to escape, right? Which is why there is such a high correlation between addiction and trauma.
Mm.
But there are also other responses. For example, research shows that anger is the most dominant symptom in men with PTSD. So often men with anger issues are sent to anger management programs instead of addressing the underlying issue, which could be traumatic events. There are other responses, um, high levels of anxiety or depression, um, OCD can develop from trauma, and how a person manages it depends, again, as I said, on resources. Some would reach out to for social support, And we know that that's a good buffer
Mhm.
for the effects of trauma. And if a person doesn't have good support, they might do other things.
May I ask a
There was,
question? Oh,
go ahead.
I'm so
No,
sorry.
go ahead.
I was thinking about my mother. My mother, she transitioned in during COVID, but not from COVID. But she was a survivor of breast cancer many, many years ago before she transitioned. But the doctor said that her onset of breast cancer, which was almost a stage one, they said it caused so early, was due to stress. Have you, and which was correlated from trauma from some things that she had dealt with. Have you seen that in any aspect? That was new to me, and I have yet to
Mm.
hear it, and I'm searching for it. But where trauma then correlates to this very egregious, terminal, in some cases, health impact to one's body.
Mhm. So I think intuitively, a lot of us feel like it makes sense that there is a relationship between trauma and some illnesses. And there are some obvious ones, like, say, high blood pressure. That's kind of obvious. But when it comes to cancer, there are some studies that suggest a relationship, and especially if we look at the hormonal aspect of it, because hormones are tied to emotions. So there is a mechanism, but there isn't yet a definitive research that says, yeah, we know that this causes this or that it plays a significant role. um, it's being studied. It's research. That's the best I can say right now, and we have to be really careful with telling. And in my practice, it has come up a lot because in the first 5 years of my work in the field, I almost exclusively worked with cancer patients and their families, and a lot of them came in feeling like they have done something wrong psychologically, that they haven't addressed something that they should have. They should have addressed trauma or a bad relationship or anything at all. And just there isn't yet that kind of, proof. And so the danger in suggesting it to people is that they end up feeling guilty. They feel like they have brought it upon themselves. So I'm very careful with that. I'm not dismissing the possibility because
Yeah,
I know they're looking at some possible connections, but we're waiting for something more definitive.
thank you.
Mhm. Sometimes I know that I have some effects from stress. Whenever one of the things that it seems like it hits first, I'm unable to sleep through a whole night. So I suffer from sleeplessness.
Hmm.
And I just think that stress hits people different ways.
Hmm.
I definitely think that it can affect the way that you look at things, the way you think. And I'll just mention this. A young lady that I knew recently decided to, I don't want to use that word, but she's not here any longer by choice.
Mm.
And I felt so devastated. I felt so bad because they're young and it had to be stress that she couldn't handle, being overwhelmed, feeling hopeless, even though she had family that cared about her. But the first thing I was thinking about, I wish I could have done something. I wish I had known. I wish I could have done something. So I think stress, I think trauma, I think depression, I think hopelessness can contribute to people having a negative outcome.
Absolutely. And You mentioned sleep issues, and we know for sure that chronic sleeplessness or sleep deprivation, insomnia, actually undermines the immune system, can, if a person already has depression, it would be worse, or anxiety. And some psychiatrists, look first of all at sleep, and they would tell the person, you need to address sleep as the first thing before anything else, and then we will look at what medication and so on, because there is such a very strong correlation between health and sleep. It's, for example, in fibromyalgia, the research shows a very strong correlation between insomnia and fibromyalgia, as well as chronic fatigue. So, you can trigger all kinds of issues, not to mention being irritable and getting in conflict and so on. But health-wise, sleep is critical. The number one to address if you're dealing with, anything really, address sleep, and then some of the other things will improve, and then you'll see what else needs to be treated.
What are the type of things that you would recommend that a person can do if
For
they
sleep?
have gone through no,
Oh,
for trauma?
well,
Because sometimes people may not even be aware of how they're
true.
being affected by trauma until, it could be months, years later.
Mhm.
They may just figure, oh, I've gone through it. What's wrong, Koya?
Yeah, no, I was gonna say, or even recognize, I think we're saying the same thing, that it is trauma.
Mhm.
It's normalized,
Absolutely.
abnormalities that have been normalized, and you don't even identify that as trauma.
100%. I've worked with people who told me, when I asked, tell me about your childhood, they said, oh, I had a typical childhood. And then when I start to ask, and they're coming in, let's say, for addiction, then telling me they had a typical normal childhood. And then when I start to inquire, it turns out they had a very abusive father, and the father was beating them and their mother, but they normalized it. So they don't even know that their use of substances is linked to those early life experiences. So you're absolutely right. So in terms of treatment, what I would say a starting point is look for a qualified practitioner, psychologist, psychotherapist, and people who clearly have experience working with trauma, if that's what you're looking for help with. The field continues to evolve. When I finished university, and during my studies, the the traditional approach was the dominant one. So talk therapy, basically, and cognitive behavioral therapy, which is a type of talk therapy where you're looking at what we call cognitive distortion. So, whatever beliefs you're holding that maybe are distorted and need to be kind of corrected or balanced. But for trauma, for a more severe trauma than, let's say, everyday kind of stress, talk therapy actually alone could be harmful. And Bessel van der Kolk talked about, he actually quoted the research that shows that you can take someone who is subclinical PTSD and turn them into full-blown PTSD just by asking them to tell you about your trauma if you don't do anything else.
Yeah.
So very early in my career, I realized that I'm missing something. So I began to pursue training in additional tools. So I trained in biofeedback, for example. Mindfulness meditation, of course, really good, deep breathing, and so on. Then EMDR came into the world, and it was right after, I think it was the Oklahoma bombing. There was some major event, and I trained soon after that. And so that was different, eye movement and, very different than typical talk therapy. But it allowed for sometimes better results. And then when I started to work at Bellwood at the Addiction Rehab Hospital, and I was asked to develop the program for the soldiers and the frontline workers dealing with PTSD and addiction, I researched what else was there and came across the acupuncture or acupressure tapping, emotional freedom techniques. And that just was a game changer. That just threw everything, to the trash almost. And what we did was when we took people, first of all, I got all my staff, when I put together the program, I made sure we all trained in it properly. And then we did with the groups, because the program was group based, we did a trauma processing individually with them using tapping while they're talking and guiding them and helping them very slowly and safely process the trauma. And the results were just unbelievable, like nothing else before.
Tapping pressure points
Yeah.
If
in
you
their
look
body.
up later, emotional freedom techniques, acupressure tapping, you'll see there's tons of material. There are videos, but it is something you still, at least when you start, you need to work with someone who knows what they're doing. And
But also, not to interrupt you, I keep hearing you say know what they're doing and they're certified and whatever. When I was going through domestic violence as a victim and also as a survivor, I found so many people that were certified and they had training, but they did not know what I was going through. So I think it's very important that you find someone that can relate, that can understand what you're going through. Because unfortunately, what happens is that person who has not been through anything and, perhaps lives in that glass house up on the hill and has never experienced any type of abuse, they're not going to understand what you're going through. And so that's primarily why I've written all my books. That's primarily why I have my workshops, because I can seriously look a victim or a survivor in their eyes and say, I know what you're feeling. I know what you're going through. I know it's hell, but I'm going to help you get through it with some of the tips, tricks, techniques, things that I've used. So I feel that's important, and that might be a missing part that a lot of people aren't looking at. I do a lot of work with the California Indian Legal Services here in Sacramento. We do the whole state. There's over 109 tribes. And unfortunately, Native Americans are one of the groups that have unbelievable domestic violence. And one of the counselors she's not a survivor. She has no clue. And so she's not as effective as she could be and should be. I'm not saying for her to go out and get abused. That's not it at all. But I'm saying that it was an incorrect placing of her as a counselor, because I am a certified domestic violence counselor. I can honestly say that I have been through just about everything except or fortunately death that victims have gone through. And so I think that is it's huge. It's paramount.
Absolutely, I agree.
Do
And
your counselors, the one that you work with, have they gone through anything similar,
I was
like
just
drug
going
abuse or trauma or anything like that?
I was just going to say to actually address that exactly. So in the program, most of the practitioners who worked at Bellwood with me had themselves been in recovery from something, or had a very close connection. So they understood, they had that insight. And it's important for the buy-in of clients that, an example would be when I was teaching people techniques about insomnia, I demonstrated tools that I said worked for me. So, for example, one of the tools that I, by fluke, ended up using and fixed a repeated nightmare was I re-scripted a nightmare, a scenario in a dream that I had, and decided that, told myself every night before I went to sleep that if this nightmare happens again, this is what's going to happen, right? I instructed my unconscious to change the outcome. And I could only achieve that when I understood first the message of the dream, the nightmare. It was basically signaling to me that I was overstressed, that I had too much going on. And actually, the nightmare was I was entering an elevator that was shooting out of a building, out of control. And it always happened when I had way too much on my plate. And so when I rescripted it after understanding what it was about, next time it happened, I pressed the button. That was part of my script. I said, press the button so that the elevator would stop. And I did that. And it opened in the university where I was studying at the time. And I walked around and it made complete sense. And that was it. I never had that nightmare again. So I've used examples like that. And then people that I worked with knew that I'm not teaching them something from books. This is not a theoretical kind of approach. It's something that can work for them. And then what people did with that was just phenomenal. So yeah, absolutely. So, and being able to talk about my own trauma and how the insight and the progress and the fact that you can have, maybe initially have a lot of symptoms and then learn to manage them better over time. And so it gives hope to people when a therapist speaks from that experience. So I 100% agree with you that that's a much better option.
When
Because you deal with people who have addiction issues, do you think that people become addicted to drugs, they turn to drugs either just for fun, peer pressure, or because of trauma?
So, there is the saying everybody knows, nobody, when they're a child, says, I want to grow up to be an addict. Like nobody really has that vision. But there are, I would say the majority of people with significant addictions have some kind of trauma history, something they couldn't manage. The reality is, though, that there is peer pressure, in adolescence to drink, to do some drugs, very available, very easy for young people to get. And when you have a combination of, adolescence is a very vulnerable age, right? And, the stress that teens have is anything from, do my peers like me? Am I pretty? Am I skinny enough? How am I doing in school? And then at home, what's going on? And, maybe they're being bullied and who knows what. So there are stressors, right? There are objective sources of stress. And what can happen, and I've worked with a lot of people who told me, I didn't really have some.
Keep going.
Okay, I didn't really have significant trauma in early childhood, but my teen years were very stressful, and then I discovered that when I drink or when I smoke marijuana, I calm down, I feel so much better. And they gradually, went from that to either a very high level of use or to other drugs and so on. So the stress is a big factor. Wanting to fit in can play a role, but typically they can grow out of it if there aren't underlying uh, severe stressors or traumas. They go to it, they see, oh, you know what, I don't like how I feel the next day, or it's not worth it, doesn't solve my problems, and so on. So they move away. But when there is something that they discover that they can take away, like pain, um, you know, feelings that they can't manage otherwise, then they'll stick with it and it usually escalates.
Does anyone
When
have
I
anything? Go
I,
ahead.
I was just going to say it was interesting. A lot of people, when I was going through my abuse, and then became a survivor and started talking to people, they could not believe that I did not turn to drugs or alcohol. And there were a couple of reasons why I didn't. Number one, I was a competitive athlete at the time, and I kept that mindset. The second thing was that I had to always be on point because he was always doing stupid things.
Mm,
Like I couldn't be drunk or high or anything and be in the car because I was going to have to grab the wheel or slam on the brake or something because he was driving stupid.
mhm,
Or maybe there was a drug deal that he took me in the middle of, which happened many times. So it was good that I had those um, I'm not quite sure what word to use, but I had those parameters that I had to stay within. And so I didn't have to deal with that coming out, which
mhm.
was great.
Yeah. And there are all kinds of things that can save people from this path. And you just gave an example. It can also be just having one person in your life that is believes in you, that supports you no matter what. That kind of redeeming element in an otherwise totally unmanageable life, right? So,
We
yeah.
good.
Sorry.
I'm sorry.
No, go ahead.
I was just going to say we work with organizations across the country to help pets that are in a domestic violence situation with their owners get out so we can foster and board them
Wow.
within usually an hour. We can get
Mhm.
it done. And a lot of people don't realize that 70% of victims stay in a household because of that pet. So if
Mm,
we take that out of the situation, that's off their plate. They don't have to worry about it. Their animals taken care of, their animals loved, they're not hurt in any way. My husky, one of my huskies, for example, was a victim of domestic violence. His dad bought him for his mom when he was 8 weeks old, and that was supposed to keep her in the relationship. She left anyway, and he beat the dog so badly. Unfortunately, Hachi lost his eye at 8 weeks old, and
mhm,
I adopted him at 10 weeks. So he's kind of my poster child.
mhm,
But that was another reason for that would be a reason for someone to not only stay in a relationship, but also stay coherent. They have to take care of another being.
yeah.
A lot of people, they have their kids, same
Mhm,
thing.
right.
Luckily, you can usually find a place for your children, but it's hard to find a place for your German Shepherd or your
Mhm.
hamster or whatever. So we make sure to do that.
That's a fantastic initiative, and I can totally see that. And the other side of it is that how much good a pet or interacting with animals can do. I've trained a few years ago in working with horses, doing equine assisted therapy, and that's such a wonderful. I could go on and on about how effective and incredible it is. And I'm involved in with an organization called The Haven in Toronto that is geared to mainly police officers, but other first responders too. And our key treatment modality is working with horses.
Mhm. We actually have a center here as well, and they work with children and young adults if they've had any kind of trauma or anything. You know, it makes you feel worthy. It makes you feel like you're important when an animal needs you.
Mhm.
You know, that's a lot of reason. That's one of the reasons people do stay in an abusive situation, because they feel needed. But if they have an animal that they're taking care of, feeding, walking, brushing, riding, whatever, they can shift that. And so that's when the healing starts, I believe.
Yeah.
If I may ask, conversely, if we're talking about healing, we can go back to about tapping. I lit up because that was part of my saving grace. I'm
That's
tapping.
what? Sorry, I couldn't.
Tapping. We were talking about
Yeah.
tapping.
Yeah.
So that was definitely part of my saving grace when I learned the technique. So I have my therapist, and then I have my other counselor who's specific for my tapping sessions. So and I still do it to this day. But I'm curious, you said that was the turning point. Are you speaking from a practitioner perspective with your team, from the execution, or as you were seeing how your clients were able to receive it? Because it was so new to me, and it made all the sense. And then, so I would love to hear more just how that was received and how.
So the funny thing is, I trained or discovered it and then trained in it when I was developing the program for the soldiers. So you can imagine 8 macho guys, tough guys, sitting in a room, and I'm introducing this silly technique, you know, and we tried it one time as a group, and we realized, no, they're starting to giggle, they're starting to dismiss it. I said, no, we're not going to do it in a group setting. We're going to take them one at a time. I wanted just to teach them as a group the technique to use if you're feeling anxious, not to do group trauma processing, but even that, to do as a group, no. So that wasn't received well in that setting.
Almost out of time.
What?
We're almost out of time.
Oh, okay.
So,
But when we did it one-on-one, what came out of this process of talking about the trauma while tapping was an actual clearing of the trauma and no longer having the physiological responses when they think about being able to make sense of it, to tell their story without being activated, and to move on. So that was the big shift in the approach.
That's beautiful.
okay. I'd like to thank everyone for coming today.
Yes.
That's Koya, Sara, and Teresa.
Thank you for
Thank you
having
so
me.
much.
Absolutely. That was fantastic.
Okay. Goodbye, everybody.
Bye.